Hello, everyone. I'm Susan Cole.
And I'm Matthew Hodson.
And welcome to aidsmapCHAT, our live show about HIV for people all around the globe.
Yes, we're back. It's very exciting. And we have a wonderful lineup of guests for this, our first episode of our 4th season. Good God, how on earth did we get here? Today, we have Charles Sanchez. Now, I don't know if you know him. He is hilarious. He is a writer, he's an activist, and he's a singer, dancer, performer with his own web series, which is a comedy musical HIV and sexual health show called Merce. And I was watching it yesterday and I felt embarrassed by how much I was laughing, and I'm really nervous because they're mouth on the child. Oh my God, you just wouldn't believe the language he comes out with. Anyway, we will try and keep him roughly in check for the show because we've also got the incredible Dr John McSorley. He's the president of the British Association for Sexual Health and HIV. And we have Lucy Wanjiku Njenga. So sorry, I knew I was going to balls that up, who works to empower adolescent girls and young women in Kenya.
How wonderful. I am so excited to be back and so excited with our incredible guests that we've had. So how have you been, Matthew, since the viewers saw you last?
Well, I'm fine because I'm able to get my hair cut again, and that's really exciting. Yeah, no, it's been good. I've had my 2 vaccinations now, and I'm just starting to feel a little bit more confident about kind of going out. Of course, there's all this kind of bit of mixed messaging and how safe is it? And I'm trying to be relatively cautious still. But I have gone this weekend I went to see some friends of mine, and it's the first time I've seen them since 2019, and they're my absolute favorite people. So that was really lovely. How's it been for you, Susan?
Yeah, things have been good. I am double vaccinated, which is fantastic. And many of my family members are, but I am very conscious of the fact that less than 1% of the vaccines have gone to people in poorer countries. So, feeling a little bit sad about that, but we have to keep the activism up to make sure that everyone has access. And I'm also going to be seeing you, Matthew, for the first time in over a year on Wednesday. So that's really exciting.
Like in the flesh. I mean, how weird is that going to be? I mean,
yes.
Well, I'm terrified actually.
So what's caught your eye in the news recently, Matthew?
Well, so just last week, Billy Porter, who is the star of the FX TV series Pose, which is one of my favorite shows, declared in the Hollywood Reporter that he's been living with HIV for, I think, 12 years now. And I think this is really exciting because I always feel that, the more people we have who are willing to be open about their HIV status and who are willing to dispel myths and, share information and talk about undetectable means untransmittable and all of those things, then the better we're able to tackle the stigma that we still face so much, and which also creates barriers to HIV testing and to HIV treatment. So this is great. But I often hear people saying, well, why don't people with HIV tell their partners? Or it's shocking that people with HIV don't tell their partners. And I think it's up to everyone to create an environment where we can do so. And you do that by understanding that when we are on effective treatment, we can't pass the virus on, that when we are on effective treatment, our life expectancy should be the same as anybody else's. You do that by getting rid of that stigmatizing language, which is still so prevalent within our society. And you do that by ensuring that there is an environment where we are able to talk about living with HIV without fear of violence or disdain or blackmail. So I think what Billy Porter has done is wonderful, and I just really hope that he helps empower other people to also make that leap and to be able to talk openly about their HIV status in a way which they can do so without fear.
Absolutely, very good message. And if that's what people want to do, that could be incredibly helpful, because obviously it's everyone's choice.
Absolutely, everyone's choice, and I would never push anyone to come out of the closet. I mean, for me, but I will just say that when I decided to be open about my HIV status, I just realized that so much of that self-stigmatizing was holding me back. And for me, it was just really liberating.
Excellent. Well, if only we had a liberating guest openly living with HIV who could come on and talk to us now.
Well, we've got Charles Sanchez, I hope.
It's a mystery.
Oh.
Wow.
Wow.
Can you hear me?
We can hear you, Charles,
Hear
but we
you,
can't
but
see
we can't actually see you.
Which is a shame, because you've got a really pretty face, and we really want to have that face on the show.
Are you feeling shy,
Well,
Charles?
I think you guys have muzzled me. You are worried that I'm going to curse too much or something.
That's
and
probably
so
it.
You have. It's
right. Well, we'll shift, Charles. Shall we shift, Charles?
Yeah, we'll have you back in a moment, and let's bring on Lucy.
Hi,
Yay.
Lucy.
Hello, Lucy.
Managed to make it back to your seat in time.
We did tell you, yeah, be prepared to come on at any moment. So wonderful to have you on, Lucy.
I'm so happy to be here again. Always look forward to these conversations. So such a fun and exciting space to be in with you two. So thank you so much for inviting me.
Wonderful. Well, it's fantastic having you, Lucy. And Lucy, I know you and I, we are on some of the same incredible WhatsApp groups for women. But one of the things that I wanted to ask you, that I know that we've been talking about a little bit, has been the impact of COVID on women living with HIV around the world. What are you hearing and seeing, particularly in relation to young women living with HIV?
Oh, Suzanne, there is a lot, and I feel we have dealt with most, or we have talked about so much of what has already happened because of COVID. We have talked of the intimate partner violence, violence against women and girls that has gone high. We are always trying to find places and safe houses to take our young women, and there are not many. So we are done talking. The talking phase has to end now. We really have to act on what we said we will do. There have been many commitments, and there have been many conversations around what is happening in the world, what is happening for women in women's lives, in all our diversities. And I think we have given very good recommendations. We now have to gather together, work together, ensure that civil society are at the center, resource these movements, resource our groups, at the community level, resources, for us to really implement the solutions we see fit for our community. Otherwise, I feel we have really covered so much. One thing that is not really COVID related, I think, especially here in Kenya, for women living with HIV, for all people living with HIV, but it's affecting mostly women. As you know, we bear the brunt of the epidemic. We are having drugs shortages and stockouts in our country, ARV stockouts, and we've been having for like 3 months stocks at the port that have been stuck there, and we have done everything again on this. We have advocated, we have walked the streets. Advocates in Kenya have gone to the media, they have gone to the Ministry of Health, they have lied on the floor, but still these commodities are stuck at the port. Most likely now what we'll be having stock outside, not just only drugs, but as well as cartridges for viral load testing. And when we just launched Undetectables equals Untransmittable here in Kenya, we're supposed to be celebrating and feeling excited about this. Finally, we have you equals you here, but we can't really celebrate if people will go to the health facility and not get the test done. What are we saying? If I go to a facility and I don't know if I'm undetectable, can I really celebrate this?
Yeah, it's a real challenge, isn't it? Because I think we get very excited about you because it is this incredible, wonderful, and liberating message.
Mm-hmm.
But actually, if we can't test people to make sure that they know that they're undetectable, or if people don't have access to the treatment, then
Mm-hmm.
it's not its time yet.
You know,
Well,
because it's all linked. We are only undetectable if we're effectively on medication. So if our ARVs are not there for us to take them, we can't become undetectable, and then we can't even test because there are no cartridges to test for viral load. Because you becomes a very good thing, but not working in our situation. Yeah.
It's really frustrating, isn't it? Because I mean, I think we've seen with AIDS and HIV, and we're seeing it again now with COVID, is that we have these global problems, and we'll actually never be able to end these global problems unless we apply global solutions to it. So what's happening in Kenya in terms of COVID vaccination? I mean, is there access to COVID vaccination at all?
Oh my, when I heard you talking of getting 2 of your shots of vaccine, I'm like, oh, I wish. We're still far from getting at least even a quarter of our population vaccinated. There was the first batch, and most people who got the first dose will most likely not even get the second dose. And we think this is, and we know it's all wrong. It's all wrong. We should not be having other countries where people are cutting masks into 2 and going out mask free. And other countries, you can't even have a quarter of your population vaccinated. I believe it's just wrong, and we really need to have a people's vaccine and not a profit vaccine.
Absolutely, I agree with you incredibly, and it's just absolutely shocking in terms of the inequity for COVID vaccines. But Lucy, thank you so much for coming on the show and all of the fantastic work that you're doing.
Thank you so much for having me.
Thank you, Lucy.
Thanks. Bye.
So, Susan, what news stories have caught your eye recently?
Well, it's actually pretty timely in terms of the conversation that we've been having with Lucy, but a story that's really caught my eye on aidsmap is about the health inequities experienced by women of colour living with HIV. So that there was a report that we have on aidsmap. Go to that fantastic website.
It's a very good site. Yes.
Very good. Check it out. Where we were hearing about the fact that women of colour, often linked to quite shocking systemic racism, are more likely to suffer from mental health issues, more likely to suffer from psychological distress, but less likely to be offered help and to be diagnosed. And the global health inequalities that we were talking about with Lucy seem to be very much in parallel to the health inequalities that we're seeing and continue to see in rich countries. So that's a story that very much resonated with me.
Yeah, because there's actually quite a lot of data. Well, there's some data which has just come out by one of our colleagues, or a report which is written by one of our colleagues, Dr. Darayan. And what they found was there's a real racial difference. People who experience racism were much more likely to be diagnosed, much more less likely to be virally suppressed, and to have a lower CD4 count. So what we see is these health inequalities, and it's not just HIV, but HIV is emblematic of some of these health inequalities which we see, which are particularly affecting Black and other minority ethnic communities. There was another piece on aidsmap which I read, which was looking at a program which is for Black women around sexual health. And it was, the way this program worked was that the exercises and the work that they were doing was looking at structural racism, and that it actually had quite a staggeringly good success rate. That I think the women who were involved in the program had 4% less STIs than the control group who weren't involved in the program. So it does show that actually when you do programs of work which acknowledge some of the racial health inequalities and societal inequalities that we see, which are related to race, that actually it can have an impact, which I guess is kind of encouraging, is that there are solutions, but it just requires focus and it requires resource. Yeah, absolutely.
And particularly at a time when there's conversation saying that racism doesn't exist, we really are not going to be able to address it until we acknowledge it.
Absolutely.
So, yeah. But I believe that Charles is back.
Is Charles back?
Yay!
Here I am. I'm sorry about that. I don't know what happened.
We missed you so much.
Thank you. I missed you.
So Charles, as I said, I've been watching Merce, the series, which is hilarious, as are you. And so what I wanted to know was, where does Charles Sanchez end and Merce begin? Or where does Merce end and Charles Sanchez begin?
Well, I think that Merce is a lot braver than I am. He's a lot less filtered as a character. I know you think I potty mouth, but I really try to be nice. For the most part, I'm pretty genteel. So he's much more brave and much less afraid of like looking gay, quote unquote. He's just brave and fun and full of joy and always looking for love.
Wonderful. Yeah, I watched it and it is extraordinary, and I've just it's wonderful. I recommend that everyone checks it out. But I found it really interesting, the episode where Merce was going out on a date, and I just wondered, how are you feeling now that lockdown is easing in terms of being out and about again?
This whole new pandemic was really triggering for me. I really felt scared in a way that I had not felt since I was diagnosed with HIV. And I first thought like, oh my gosh, is this going to kill me? So I felt that way with this pandemic. Sorry, I pulled out my ears.
That sounds dramatic.
I know, I got so excited. So I'm really cautious. I'm really like, I'm wearing a mask a lot still, even though I'm fully vaccinated. Because I don't trust any of y'all. I don't trust any of the people. I don't know what's going to happen. Like we didn't know a year ago what this was going to be like. So we don't know what the variants are going to bring or what the future is going to bring. So I'm trying to, with dating and everything, I'm just trying to stay really cautious.
I was teasing you earlier on about your potty mouth, and it's it's just the songs you sing. It's not you. But
I didn't write those songs. Just so you know, I did not write those.
Yeah, right. They made me sing it. They made me sing it.
Right. I wrote the scripts and the story ideas and everything else, but I didn't write the songs.
Because you've been involved with this new campaign, The More You Can Hoe, I believe, and it's not referring to gardening.
No.
So, I mean, like, how is that received? I mean, because it is very sex positive, and you were saying that Merce is going to be very positive and very open. But I mean, how do people respond to that?
It's gotten some really nice response. I mean, I think that with the HIV messaging, very often it's very stoic. Like if you look at some of the commercials for HIV medications or any kind of HIV awareness, we go to a lot of picnics, we do a lot of fun runs, but it doesn't really talk about sex. It doesn't really talk about real life. And so I wanted to do a campaign that talked about some sexual things and that was very sex positive. And so I have it's a series of 7 public service announcements with different characters from Merce talking about different aspects of HIV, from testing to prevention, U equals U, all the things. And then it culminates in a 3-minute song, which is also very sex positive.
He's in the bath. I mean, spoiler, he is in the bath.
I'm in the bath.
That English accent.
It's
I was
uncanny.
blurting
It's going to come out. I apologize.
It's like Julie Andrews is in the room.
Lots of chocolates for me to eat.
I love a bit of Dick Van Dyke.
And you know, clearly we got involved in sexual health. We didn't get involved in sexual health because we were interested in botany.
Right? Absolutely. So that was why we put it out, and we were really pleased with the result. We've gotten a lot of views. All that campaign is completely on YouTube, and it's completely free for people to watch, share, etc.
It is
Wonderful.
absolutely wonderful, and as is the series Merce, and as are you, Charles. It's been wonderful.
Thank you.
I look forward to seeing you again.
Thank you so much. Thanks for
Bye,
having
Charles. Thanks
Bye.
for coming.
me. Thank you.
So one other story which I want to talk about, because, well, I think it's something that's kind of interesting and important, is there's a story which we've just published on aidsmap about biological aging, because there has been this idea that people with HIV kind of age faster. We get a lot of the conditions which are associated with aging earlier. And so they did this study and they looked at various markers of biological aging as opposed to chronological aging. So chronological aging being how old you actually are, and biological aging being how old your body is, as it were. It does seem that HIV treatment can reverse that decline a bit after about 2 years, but it does also seem that the HIV in itself does cause the body to age faster. And I think that's one of the things which perhaps we need to kind of always be aware of, is that even though there's so much good news for people who have access to treatment, and the fact that we can now have equal life expectancy and all of that with treatment is such brilliant news, but there are still health challenges for people living with HIV, and even the treatment can't necessarily reverse all of that. So I think that's another story to be watching out for.
Yeah, wonderful. And in terms of the segue, if only we had one of the top HIV doctors in the country.
Not the president of the British Association of Sexual Health and HIV himself, Dr John McSorley. Hi, how are you?
Hello, John.
I'm very well indeed, and thank you so much for inviting me to have a short space amongst your august guest list.
We are delighted to have you on the show, John. Now, John, you, before the show started, you were telling us about some early data you were looking at around STIs. We've been talking a lot about sexual health and STIs on this show. That you're in a newspaper recently saying that there may be a tsunami of STIs on its way as people come out of lockdown. So what's the data telling us?
So I have a feeling that I think it was the reporter who decided to describe it as a tsunami of STIs. But actually, I don't think that it's too far off the mark. On the one hand, we don't have to be overwhelmed by STIs, but last year was a very odd one in so many ways. If we go back to the beginning of 2020, I was mouthing off, pointing out that in the UK, for example, we had the highest number of syphilis diagnoses since World War II. And for gonorrhea, we had the highest number of cases of gonorrhea diagnosed since our records began, all the way back in 1917, in the middle of World War I. So our concern there was that we had this constant rising surge of some STIs that had come to pass. And then there was a different experience. COVID clearly had an impact, and it had an impact both on testing, but also the transmission of infections. And certainly there was a potential hope that perhaps the impact of COVID might break the chains of some transmissions. The good news is that some of the numbers of some of the STIs did drop last year, and this was observed pretty much across all countries in Europe, in the US, and elsewhere. However, from about the summer onwards, we've seen a slow, steady upward swell of infections more or less across the piece. And that particularly relates to many of the bacterial infections like syphilis and gonorrhea, also some viral STIs, or sexually transmitted infections like herpes. And then there are 1 or 2 new kids on the block. The Shigella, which is a form of infectious diarrhea, which is operating in many countries as a sexually transmissible infection, because that's where the contact is taking place. And it's often not recognized because people turn up somewhere with the diarrhea and somebody thinks they have food poisoning, because this is a bug that's usually a food poisoning bug, but actually the connection has been not so much who they've been eating with, but who they've been sleeping with. Again, for many countries as well, a form of chlamydia called lymphogranuloma venereum, or LGV for short. The numbers of that in the background as we come into 2021, many of these infections, the unofficial data in many countries are saying that we are back where we were just a year ago. And it'll take some time for definitive information to become available, but it looks like it's a steady upswelling, but we hope it doesn't turn into a crashing wave. But there are things we need to do about that.
It is quite interesting, isn't it? Because we consider how we've been in lockdown and how, I mean, it's actually in the UK, it's only been a week that we've allowed to, legally allowed to have sex. But of course, people have been having sex, because if you're single and, you were told a year ago, oh, you're not allowed to have intimate relationships with anyone, I mean, you're not going to. Well, I mean, to be honest, I wouldn't have been able to back in the day. And I guess one of the things that's really important is that people show up, that people do actually get any STI they may have diagnosed, or if they think they may have been exposed, that they go to a sexual health clinic and be assured of a non-judgmental service.
Oh, absolutely. I mean, I think one of the problems is that for many infections, actually, most of them have no symptoms at all. So people may not have any awareness that there's something bubbling away down below. But most clinics, absolutely, will be stocked and staffed by non-judgmental staff, most of whom, all of whom have been in the same position themselves. So it's just, these are shared experiences that we all have, and we need to go forward and get them addressed. And I suppose the other thing that for perhaps higher income countries, there's been an extension of access to online tests. So people have been able to buy legitimate tests through the internet and have things posted out to them. That certainly is certainly for Europe and the US, expanding access to digital testing mechanisms is a really important part, because you may not necessarily need to go somewhere. You can have the kit sent out to you.
Fantastic. And as people get out there, out and about, and in terms of women, obviously, women are sexual beings as well. And with regards to preventing HIV, a study on aidsmap found that women have low levels of awareness of PrEP. And what can we do to address that?
Well, I think first of all, we have to talk about it. We have to talk about it, and we have to talk about it over and over again. We have to advertise, we have to communicate, we have to get the messages out there. I think sometimes some of those of us working within sexual health think we're talking all the time about the same stuff. Often we're not. We often forget and assume that people are aware of things. And it really calls on a huge sort of society-wide package of starting the conversations, having the conversations, continuing the conversations, and coming back to them again. And that's on a whole wide range of things about, prevention, including PrEP, but also, sort of getting tested and treated for infections, contraception need. Really important, Susan, what you said about the sort of many of the structural inequalities. I mean, if I look at sexual and reproductive health care across the UK, and for that it's the same in every single country across the world, women are constantly disadvantaged. The sexual health services in the widest context, that's gynecological services, or access to antenatal care, and access to menopause care, there is not enough of it. And if you look at health services across the world, they're all orientated towards the needs of men rather than women. And I really think that's just women should be put in charge of all of these things, have the budgets, and suddenly you would see a significant change. But I don't know whether you would agree, Susan.
I would agree very much with you. Matthew?
I would agree, absolutely. Mark, women are so much. John, it's been really delightful to have you on, and thank you so much for coming on and for talking about women and for talking about PrEP. As you say, we've got to keep just talking about these issues, and that's how you raise awareness. So thank you so much.
Thanks so much, John. Bye. Oh my goodness, I think we have run out of time. How is this possible?
Where does it go? So, who do we need to thank, Susan?
I would like to thank Lloyd's Pharmacy, Theratech, Disruptive Studios, all our viewers around the world.
And Lucy and John and Charles, as well as, well, everyone. Thank you so much. Everyone we've ever met.
And we will see you in 2 weeks' time.
Marvellous. See you then.
See you then. Bye.